reporting bias in selective publication. Small sample size. Results may not represent broader population because a unique example, COVID-19 outbreak 2019. This COVID-19 outbreak, unique it shows symptoms and I feel we be sure now we have a show, and I feel very serious. Initial case report and case series in Wuhan described pneumonia of unknown origin leading to identification of source. Real vaccine side effects. Case series documented myocarditis. In young males after vaccine. Prompting further investigation into real vaccine side effects. Maybe a new vaccine. Now, you get the say from a population immunity. Maybe the war. Nipa bakuna started so we not side effect then now feed it a baby. Monkeypox resurgence. Case reports highlighted unusual transmission pattern outside endemic regions. Aside baby and it begins to spread in a binya. Reporting a baby series, a baby. Drug safety monitoring. Case series have identified well adverse effects of new cancer therapies and biologics. Experiment. Experimental studies are research designs in which the investigator actively intervenes to test the effects of an exposure or treatment on health outcomes. Unlike observational studies, where researchers only observe natural occurrence, experimental research involves controlled manipulation of variables. The most common type is the randomized control trial. Experimental settings observation and now or intervene. Observation can say a researcher does not intervene but rather observe and analyze outcome and disease. By experimental research design in which there's an investigator actively intervenes into an investigator. Once we are now the interventions to test the effect of an exposure or treatment on the health outcome. Unlike observational studies, where researchers only observe natural occurrence, experimental study involve controlled manipulation of variables. The most common type is the randomized control trial. That's the RCT. Considered the gold standard for establishing causality. Advantages of experimental study. Strong causal interference. Randomization ensures exposure proceeds outcome and reduce confinement. High internal validity. Controlled condition minimize bias. The interventions can bias, multiple outcomes, and also one intervention can be studied for several health effects. Nti te sɛ yɛde intervention wei ba na ɛboa yɛtumi sua ɛde ɛba other health. Policy relevance, results directly from clinical guidance and public health strategies. Nti ɛsan sɛ yɛ experiment ɛnyɛ obiara na ɛtake, like obiara na ɛyɛ clinical guidance, obi guide, obiara like onim public health, you see public health strategies. Disadvantages of experimental studies: expensive and time consuming. Say experimental, Uber introducing intervention time consuming and expensive, and requires large sample size and follow-up. If you open experimental was open sample as I want by experiment, it's in a year time consuming and expensive, and ethical constraints. Not always possible to withhold beneficial intervention. Limited generalizability, control settings may not be